Good morning, ladies and gentlemen. You are listening to the voice of the moderator, welcoming you to the e-press conference to thank our Honorable Prime Minister for the path-breaking reforms that he has brought in the field of higher medical education. Ladies and gentlemen, we have 19 experts amidst us, and 5 of them are representatives of the government. Dr. Vinod Paul, Sri Javed Akhtar, Dr. Abhijat Sheth, Dr. Pawanindra Lal, Dr. C.N. Manjunath. I have the pleasure of giving you the list of the other panelists: Dr. Alexander Thomas, Dr. Srinath Reddy, Dr. Naresh Trehan, Dr. Giridhar Gyani, Dr. Anna Pulimod, Dr. R.D. Ravindran, Dr. Lallu Joseph, and of course Dr. Devi Shetty. And the others with us are Dr. Rajashekaran, Dr. H.S. Chabra, Dr. Venkatesh Krishnamurthy, Dr. Babatosh Biswas, Dr. Vijay Agarwal, and Commander Dr. Navneet Bali. With that, I have the pleasure of requesting Dr. Alexander Thomas to formally welcome the participants to this e-conference. Dr. Alexander Thomas is the president of the Association of National Board Accredited Institutions. Over to you, Dr. Alex.
Thank you, Dr. VC. Good morning to all of you on behalf of the Association of National Board Accredited Institutions and our sister organizations, the Consortium of Accredited Healthcare Organizations and the Association of Healthcare Providers of India. It's my pleasure on behalf of all of them to welcome all of you, friends from the media and state chapter presidents of the association, and also our eminent panelists who are going to speak today for this press conference. We would like to express our thanks to the Honorable Prime Minister, the Government of India, the Ministry of Health and Family Welfare, and the National Board of Examinations for this path-breaking move of introducing diploma courses under the NBE in the much-needed specialties. Though the Government of India has over the past few years significantly increased both the undergraduate and the postgraduate seats, this particular move, which was gazetted last week, this move will make a huge impact which will show results in the very near future. All of us know that among the major factors for the reasons that we are unable to provide quality universal healthcare to all the citizens of our country is primarily the shortage of specialists. Countrywide, we all know, both in the private and especially in the public sector, there is a huge shortage, up to 85% of shortage of specialists in some of the state governments. And this is a major obstruction to improving the health indices in our country. Apart from the increasing number of the specialists, the quality of care of the training institutes remarkably, and this is evident from the Karnataka experience. Importantly, with the National Board track record for quality and standardization, we are assured of quality healthcare professionals. AHPI and our sister organizations are committed to the government, and we will do whatever possible to help in this endeavor. AHPI has been handholding and training faculty of district hospitals in some of the southern states, and these clinicians have greatly benefited from the faculty orientation and training programs of AHPI. Incidentally, in Karnataka, this initiative started as a public-private initiative a few years ago, about 3 to 4 years ago, where we tried to make district hospitals training institutes for the National Board. The first batch has just passed out with outstanding results, and they will all join the government service now. We now propose to create a training module for the entire country, which can be delivered online. This will give the much needed confidence to the busy clinician as he or she now starts training students in smaller hospitals. So let me conclude by saying that this important decision, if appropriately implemented, and I'm sure it will be, looking at the rate at which the National Board is progressing, this will create a sea change in the healthcare industry in our country and the healthcare delivery in our country. And the dream of universal healthcare will soon become a reality in India. Thank you very much.
Thank you, Dr. Alexander Thomas. And after having welcomed the distinguished members of the press and the media, I have a small announcement to be made. I would request all the members of the press and the media to post their questions in the chat box, which will be taken up after the panelists have made the presentation and the closing remarks has been given. With that, I would request Dr. Srinath Reddy, the former president of the National Board of Examinations, which is Diploma Courses, to tell us very briefly about the history. Srinath Reddy, please.
Thank you very much, and good morning. Everybody. The National Board establishing it at that time was 3 years to include anywhere at any time between 500 to 700 institutions, which span both private sector institutions as well as public sector institutions such as the Army, Railway, and PS. It had to MD or MS. Then it is also a 2-year fellowship of the National Board, which provides further super specialty training. In addition, there are super specialty programs of 3 years, which are also there. And we also have several additional smaller diploma programs in association. But all told, now, as of June 2020, about close to 10,000 people are being trained in the DNB and fellowship of the National Board programs, in terms of about 9,779 registrants. But the important element is that apart from providing training in a wide array of postgraduate programs, which are also covered by medical colleges, it now extends to multiple areas across the country where medical colleges do not exist, but also covers a number of other areas where our traditional medical postgraduate examinations do not cover. Like, for example, rural surgery, trauma care, and a number of other programs that have been established in family medicine. And even in terms of fellowship programs, areas like sports medicine, pediatric gastroenterology, arthroplasty, just to give you a few examples. But recognizing the need to spread further, and particularly to strengthen district hospitals, both in terms of care and their educational capability, the National Board of Examinations in 2012 took up a proposal to establish, in the first instance, the DNB program in district hospitals of West Bengal. And now the states of West Bengal, Andhra Pradesh, Delhi, Haryana, Himachal Pradesh, UP, and Gujarat are running these programs. West Bengal at the moment has 55 seats, and UP has about 25 seats, and others too. So we recognize that with the spread of these programs and the ability of district programs to actually initiate these, with the availability of specialists there in the district hospitals will now fulfill a very effective educational mandate. At the same time, the standard of care in those hospitals also will go up once the postgraduate training programs start. Therefore, both in terms of the educational objective as well as the healthcare objective, strengthening of the district hospitals through the recognition for imparting DNB training is a great step forward in our advanced universal health coverage.
Thank you, sir. Thank you very much, sir. I would now request Dr. Naresh Trehan, Chairman and Managing Director of Medanta, to tell us in brief as to how will the private sector be benefited by this Gazette notification. Dr. Naresh Trehan.
So first of all, let me compliment the warriors for this policy. So Alex, of course, Devi, Shetty, Giridhar Gyani, and many others along with us.
Sir, sorry for interrupting you. I would request you to directly get into the topic so that we can say others. Please.
All right. No, we are wasting more time in this dialogue. I'm coming to that. I have 2 minutes. I'll finish it in 2 minutes. So the basic thing is that this is a catch-up play that we have done today, because there was a mismatch between our ability to provide quality care to our patients outside of tertiary centers, may it be government or may it be in private sector. So this will be a major step forward for us as private providers, that we can get access to people who we can train, who will be an asset not only to us, but to the country moving forward. So these 8 courses that have been approved is just the beginning, I think. Once we have success here, I think we can add many more specific diploma courses. We have a very big success from PGDCC, which was discontinued, which was for creating rural cardiologists. I think this concept will gather more and more momentum. So I must congratulate AHPI, all the other workers who fought for it. And I can tell you in one word, it will be a great asset and boon to the private providers, because we do have shortage of specialized workers who can deliver care in our peripheral centers, in our smaller hospitals. So we are grateful that this has happened to the Government of India and to National Board. Thank you.
Thank you, sir. Wonderful for having kept timings. And may I now request Dr. Giridhar Gyani, the Director General, Association of Healthcare Providers India, to tell us about the AHPI's role in furthering medical education in India. Dr. Giridhar Gyani.
Thank you, Dr. VC. As you know, for my media friends, AHPI is the not-for-profit organization which is representing vast majority of the private hospitals in our country. Now, as you are knowing, the private sector is providing more than 60% of the secondary care and more than 85% of the tertiary care beds. But these hospitals are largely located in Tier 1 and Tier 2 cities. Private sector is not able to invest in Tier 3 cities for the simple reason that we do not have the specialists even for Tier 2 cities. Now, the medical education which is being provided by the medical colleges, we have 542 medical colleges. And I must tell you here that vast majority of these medical colleges is in southern India. I'll just give one example. The Karnataka, with a population of 6.7 crores, has 60 medical colleges, 60. While Madhya Pradesh, with a 8.5 crore population, has only 13 medical colleges. They have 80% shortage of the specialists. If you follow the normal education pattern, even next 10 years, we will not be able to provide these specialists. So the only way is to convert the hospitals into the teaching hospitals. So this initiative by the Government of India is, I think, going to cover up that very aspect. Association of Healthcare Providers, which having now 10,000 hospitals as members, is going to work with our members in support from NBI and prepare these hospitals to run the diploma program. Thank you very much.
Thank you, sir. Thank you. Thank you very much. We now move on to Dr. Anna Pulimud, Principal of the Christian Medical College, Vellore, who will tell us as to how the Christian mission hospitals across the country will be benefited by this. Dr. Anna Pulimud.
So thank you for this opportunity. There's a network of about 1,000 small not-for-profit mission hospitals located in remote, rural and semi-urban parts of our country. They exist purely to serve the local population and complement the government district hospitals and primary health centers. Their role in caring for people has been highlighted during the current COVID pandemic, when they've kept their doors open to take in people sick with COVID infection, working closely with the government. These hospitals are usually small, with just 20 to 200 beds. Some of them have specialist doctors like physicians, surgeons, and ophthalmologists. But finding enough specialists to work in all these small hospitals is extremely difficult. Most specialty training takes place in large hospitals in cities and big towns. Doctors training in those centers prefer to continue working in similar areas. This initiative of the National Board will encourage further decentralization of training and hopefully increase the number of specialists available to our mission hospitals and other small hospitals located outside big metro areas. But not only will this increase the pool of seats available for basic medical and surgical specialties, but competition for these diploma seats will also be a little bit less than that for the regular 3-year degree courses. This will be of help to doctors working in smaller hospitals and rural areas who are disadvantaged in PG entrance exams as they don't have access to coaching centers that are all located in big cities and towns. These doctors will be helped to qualify for admission to diploma courses as against the 3-year degree courses for which there's so much more competition. Having already worked in rural India, they're more likely to go back to serve the people there, helping to address the great shortage of specialized doctors in rural parts of our country. Thank you.
Thank you, madam. Thank you very much. And with that, we move on to Dr. R.D. Ravindran, who is the chairman of Arvind Eye Care System, who will tell us as to how the human resources availability is going to dramatically improve by this.
Thank you. I'm happy to address all of you from press and media on this occasion of thanking our Honorable Prime Minister, the Health Minister, and the National Board of Examination and its President for the ongoing reforms in the higher medical education shows to make the specialized healthcare available to all our people in the country. Briefly about Aravinda hospitals, we are located in about 14 locations and providing nearly 5% of the eye care to the country. But also as a responsible organization, we are also involved in nation building through training of postgraduates in ophthalmology. We train about 50 postgraduates every year. And we also train nearly about 100 other qualified ophthalmologists in subspecialty ophthalmology. And we have contributed nearly about 20% of the manpower in this country, but still we have sufficient capacity to train more and more ophthalmologists. When India is a large country, and as per the WHO guideline, we need one ophthalmologist for about 50,000 population, which means we need about 28,000 ophthalmologists in the country. But today we have only about 17 or 18,000 ophthalmologists, and many of them may not be in active practice as well. So there is a real need to address this shortage. In addition, with increasing age and the incidence of diabetes and hypertension, ophthalmology is also becoming a chronic care specialty, which means this 28,000 is not going to be sufficient. Similarly, like ophthalmology, the same problem exists in many other specialties as well. So the shortage of primary healthcare providers at the primary healthcare centers, as we talked about most, India faces a severe shortage of specialists both for its rural and urban services. And if you take the recent report, the rural health statistics of 2018-19 from the central government, nearly 80% of the posts of the specialists, surgeons, physicians, pediatricians, gynecologists at the community health centers, which provide minimum basic specialist service for the rural people, is lying vacant. Hence, there is a real need for manpower in specialties like obstetrics, gynecology, importantly in pediatrics, anesthesia, and also in chest diseases at this time of the COVID pandemic. So rightly at this time, the efforts taken by many of the members here and also by the central government under the leadership of the Prime Minister, starting this postgraduate diploma courses under the National Board of Examination in 8 broad specialties will go a long way in addressing the need for providing the specialty healthcare in rural areas. So what we need to understand is we are talking about providing basic specialty care. So we are not talking about tertiary specialty care like cardiothoracic surgery or a neurosurgery. It's a basic specialty care because earlier many of these services were provided by a general practitioner with an MBBS. But today, with the explosion of the knowledge of equipment and technology, we need specialized people to address this care. And in addition, this effort by the Prime Minister and the Health Minister and the National Board will also help to address the aspiration of our younger doctors, the medical graduates who come out of the medical colleges. And again, because of the initiative of the government, today we have nearly about 60,000 doctors come out of medical colleges. But we don't have that many seats in the post-graduation. But adding these few thousand seats in the postgraduate through this diploma channel will definitely address the aspiration of these doctors. And we also have the training capacity in many of the hospitals like us, especially in ophthalmology. So all these together, making the seats available will help the rural population, will also help the doctors who aspire to become postgraduate trained specialists. And in long term, it will also help the whole economy of the country because we'll have better health. So for all this, all the efforts taken by members and also the efforts taken by the National Board and also the support given by the Health Minister under the leadership of the Prime Minister is something we really welcome and really thank all of them. Thank you.
Thank you very much. I would now request Dr. Lallu Joseph, Secretary General, Consortium of Accredited Healthcare Organizations, to tell us about the quality. How is it going to be assured by the National Board of Examinations in these diploma courses?
Very good morning to you all. I bring greetings from the Consortium of Accredited Healthcare Organizations. Quality of healthcare systems can be assessed by three components, namely the structure, process, and outcome. If we apply that to the new system, National Board has structured methodology of empaneling hospitals based on parameters like qualified specialists, caseload, case mix, and also the infrastructure. The process of delivery is ascertained by having structured curriculum, and they also have the unique strength of converting practicing clinicians as teachers. Outcome measures in terms of exit exams conducted by the board are structured, and the same exam for the entire country. This ensures standardization. This new policy will greatly minimize the demand-supply gap and will help in enhancing quality and patient safety. On behalf of the Consortium of Accredited Healthcare Organizations, we extend our thanks to the Honorable Prime Minister for this new move. Thank you.
Thank you, Madam. And now Dr. Vinod Paul, I think, will be joining us a little later. And we have Dr. Abhijat Sheth, who is the President of the National Board of Examinations, to tell us about the future plans of NBE. Sir, Dr. Abhijat Sheth, please.
Namaste to all of you. As you all mentioned, that this is the big step forward in supporting the vision of Honorable Prime Minister about the creating a healthcare access uniformity across the country, and particularly in the small regions. And in the context, these diploma courses are certainly vital to us, as the other speakers has mentioned. National Board of Examination has always been a progressive organization, even before us, with us, and going to be after us. And the biggest asset with us is our faculty mentors like Professor Shetty, Professor Trehan, and all the on-by doctors, Alex Thomas, and everyone. And we respect their roles, and even to the extent that I mentioned this to the government, that this is the biggest strength the National Board of Examination is having, that they take a proactive part in reforming the National Board. Having said that, once we took our tenure, we concentrated mainly into teamwork, stronger integration, focusing on the objectives, and immediate and strong decision making with implementation. This has helped us a lot, as togetherness, with the togetherness, we should be able to achieve far more better result. And in the quantum way, we are progressing with the National Board of Examination. As you all have seen, that we have almost doubled the number of seats, and we want to double it further in coming 5 years. to 20,000 seats across the country. Our biggest objective, the first objective, is to ensure that every undergraduate students have an opportunity to advance further into the medical training, either through degree courses or through fellowship courses or through diploma courses. And they should have an opportunity to serve in the different regions, all the regions across the country, wherever they feel to do so. In the context, we have planned to create these different courses, and we want to move fast with the courses. But one thing we realize, which is our second biggest objective, is when we create numbers in a quantum way, we have to ensure the quality must not get compromised. And hence, we are focusing a lot on the creating the quality structure to ensure that while increasing the numbers of the training opportunities across the country, the students must feel that they have acquired the desired training, which their aspirations were like to do so. And we have a strong team. Even my colleague is here, Professor Pawanindra Lal, and we have even come up with many innovative ways in accreditation system, in learning modules, digital learning, skill modules we are developing, and even to the extent the examination methods, which we have, even in the COVID era, we have created a unique modules in the examination system, which my colleagues will mention. With all blessings from all of you, we wish that the National Board will continue their journey in line with the governmental objectives, the national objectives, and we all will support and work wholeheartedly to do this. Thank you so much.
Thank you, sir. May I now request Dr. Pawanindra Lal, Executive Director of the National Board of Examination, to tell us as to how are we going to roll out these diploma courses.
Very good morning to all of you, and thank you very much for this kind opportunity to address the leadership of the country amongst various organizations and esteemed senior faculty members from their various professions. A lot has already been said about the launch of these 8 courses in the 8 specialties for the diploma program by the Gazette notification issued by the Government of India on the 6th of August. And we see that this would be a path-breaking step. Amongst the discussions that the National Board had within the last 3 months with the government and the Medical Council of India, we discovered that there was this space of diploma category of seats, which was closed by the Medical Council over a period of time and converted to degree courses to enhance the number of teachers that were required, because the diploma candidates are not recognized as postgraduate teachers in medical colleges. So all the existing diploma courses had been converted to degree courses, and the diploma space was getting closed. And National Board was able to identify this opportunity and propose to the government that if the permission for the start of these diploma courses in these 8 specialties could be given, then not only we would be able to increase the number of postgraduate trainees in the country in various specialties and extend their extend the healthcare infrastructure support by the presence of trainees in district hospitals and smaller hospitals. And not only that, but also the National Board was also having the opportunity to train the post-diploma qualified candidates by virtue of a secondary DNB program, which is an intake of the DNB candidates, training of DNB candidates for a 2-year period who are already diploma qualified. So the exhaustion or closure of the diploma program would have led to closure of the secondary DNB program also, because we would have no diploma candidates. So this proposal from the National Board was discussed and deliberated in detail over the past 3 months between the National Board, the Government of India and the Medical Council, and a go-ahead was given by all the concerned authorities that this was a good idea, and hence the launch has now been happening. And I'm very glad to say that today is a very august day that this press release is happening, and at 1 o'clock today at 1300 hours, somehow by just coincidence, the diploma program is getting launched online through the National Board, and the diploma bulletin will go online today itself. So it's an absolute coincidence that it has happened like that, and the government has accorded its approval for the rollout of this. The form has been made simplified and easily fillable by all the stakeholders, and the criteria of the diploma requirements for the hospitals has also been reduced by the board, because it is very much aware that the hospitals where this is going to be undertaken will have constraints of beds, case numbers, and the staffing. So the faculty load has been reduced to presence of 1 faculty, senior faculty, and all the other case loads and bed requirements have been reduced to 1/2 of whatever was required for a degree program, knowing very well that this is required to be at places where there is a staff crunch, there is going to be, but certain minimum numbers have been described. So I hope that with this, we will be able to maintain the quality of training, quality of hands-on training, utilize the beds and the specialists that are available in our smaller tier 1 and tier 2 cities, and give the opportunity to these diploma candidates for their enhancement, not only as in-service candidates, but also go for the 3-year DNB program, 2-year DNB program as a post-diploma route. We have also, I'm also pleased to tell that the government has permitted 50% of their in-service candidates for in every state to be these seats to be reserved in their own district hospitals for their own state doctors, and only the remaining 50% shall be filled up by the National Board by the All India basis, and the route of entry remains the NEET PG exam, which the board has been conducting. So I'm sure that this is going to increase by leaps and bounds the numbers of trainees, and also improve the hands-on care that is required in our district hospitals, where there is no doctor after 4 or 5 o'clock till the next day morning. I think that round-the-clock care concept with the presence of residents will be vastly improved, and it will overall increase the care in the country. Some associations at this time have represented or said or felt that this is a retrograde step, that this degree, we are going back to a diploma program, is a retrograde step. And I think this is a good opportunity to allay those risks, those misgivings, and tell all these people that no, it is not a retrograde step. It is actually a step in the right direction, because it is a training which is a post MBBS candidate is getting, and there is a huge space of about 30 to 40,000 candidates who have done the MBBS but do not get the 3-year degrey course, because there are only limited number of 3-year degree programs. So I think this space will be a well-utilized space, which will be able to enhance the training in these 8 specialties to begin with. And if this program is rolled out well, we may be able to enhance and increase the number of subjects in due time in few years to come. So once again, I would like to thank all of you, and in particular the NBI, for this kind invitation, and thank you once again from the National Board.
Thank you very much, sir. May I now request Dr. C. N. Manjunath, the director of the Sri Jayadeva Institute of Cardiovascular Sciences and Research, to tell us how is it going to benefit the district hospitals by increased PG seats.
So thank you very much for this invitation to be amongst the august faculty and the policymakers. So it is the dream of every MBBS doctor to get some post-graduation. So there are nearly 70,000 undergraduates coming out every year. About 40,000 specialty PG seats are available under MCI banner. So nearly 20,000 are deprived of these postgraduate seats. So this is particularly the National Board of Examination has got a highest credibility and also has got an excellent reputation for many, many decades, I should say. So in fact, even our PG days, even after passing MD, MS, people used to take this DNB examination. So definitely it enjoys a greater credibility and reputation. And this diploma courses provides an opportunity for those who are deprived of getting these seats in medical colleges and other deemed university. So we all know today many of these district hospitals or bigger taluk hospitals do not have specialists. As a result, there is a lot of inconvenience to patients, and patient care also suffers a lot. If you look at the infant mortality rate and maternal mortality rate, the dream of India is to achieve a single-digit infant mortality rate. The infant mortality rate at this point of time is somewhere around 29 to 30 per 1,000 live births. So these diploma courses in the 8 disciplines, particularly in the area of say obstetrics, gynecology, anesthesia, and also in radiology and all those things, definitely improves the patient care. And Government of Karnataka, already under the chairmanship of Chief Secretary, has reviewed this particular Gazette notification, and he has already given directions that 179 taluk hospitals should also be mapped to see how best we can start these diploma courses. And it's a bidirectional. By starting a diploma courses in a district hospital, not only the aspirants are benefited, even the specialists also, it's an opportunity for them to get updated themselves to the latest trends in medicine or surgery, whatever it is. So because definitely it is going to improve the patient care at the tier 2 cities and tier C cities. And it's a great value addition in terms of patient care and learning, because today online teaching programs are also in place. So it is a wonderful thought process by a national board. And the clinical materials is also been plenty, in particularly in district and bigger taluk hospital, clinical materials is also good. So in that way, the patients are benefited, the doctors are also get an opportunity, and there won't be any depression or even frustration among the aspirants who do not get into the broader specialty in medical colleges. So it's a wonderful initiative. I think we should take it forward in Karnataka, and already DNB courses have started. So these diploma courses will be a value addition in other hospitals. So infant mortality and maternal mortality can be brought down considerably when we start these programs.
Right, sir. Thank you very much, sir. Now we have 2 experts, Dr. Vinod Paul, Chairman, Board of Governors, Medical Council of India, who is supposed to have joined us, but he is in a meeting with the Health Secretary. And if he joins us sometime before we close down, we will have the pleasure of listening to him. And the other person is Sri Javed Akhtar, the Additional Chief Secretary of the Health and Family Welfare Department, Government of Karnataka. And it's a matter of great coincidence that we have Dr. Alexander Thomas, who has worked with the Sri Javed Akhtar on many issues, almost on a daily basis. And I think he will be able to tell us something about the positive experience of DNB in Karnataka. Alexander Thomas, please.
Okay, so Dr. Javed is not joining us, we see.
Yeah, he is in cabinet meeting.
Okay. Okay, so I think I'll just, if he joins, it'll be great to have him. But very briefly, and Dr. Manjunath is also here, he was part of this team. This whole initiative, this private-public partnership we started about 10 years, but we didn't have much success initially. Devi would remember. It actually went into action about 3 to 4 years ago in Karnataka, where ANBI, the Karnataka chapter, Dr. Venkatesh is here, who's a secretary, he was the president of the Karnataka chapter at that time. We approached the government and said that we would facilitate a partnership with National Board to create training programs in the district hospital. We had an excellent team of officials from the side of the government of Karnataka. I still remember the first meeting that we had with the DHOs, and every DHO gave us an excuse as to why DNB should not be started. There was, in opposition to a recent meeting where they were all fired up, and over a period of a year, the government officers were able to motivate them, and they became very positive. So as a result, we now have about 100 seats in Karnataka, and soon we'll have a very robust specialist cadre because the decision taken 3 years ago has started yielding dividends, and specialists have started passing out. They have a year bond with the government, and it will help in any way. It's been a win-win situation in Karnataka. The teachers have benefited. We still get calls from the teachers saying how happy they are that they're able to teach. Students, obviously the students have done a great job, as is evident from the results of the examinations. I believe 70% pass rate, and those who are not, this includes those who are not able to take the exam. This is an outstanding result, comparable or better than the best private institution. It's benefited the community a great deal. I'm an orthopedic surgeon, and 2 years ago when I was told that district hospitals were starting to do total knee hip replacements, total hip replacements, complicated spine surgeries, I think it was a great indication of what training can do, how it can elevate a district hospital into giving good healthcare delivery. And finally, the community. The community in many areas have been so happy that I've been told by the Director of Health that many of these hospitals have been given donations to improve their infrastructure. So in brief, I hope Mr. Javed Akhtar will join us, but this has been very briefly our experience in Karnataka, and I don't know whether Dr. Manjunath wants to add anything to this because he was very closely involved along with Devi in taking this forward.
Dr. Manjunath sir, would you like to add something to what Dr. Alex has mentioned now?
No, we are working, government of Karnataka is working in tandem with Dr. Alex and Dr. Devi Shetty. Definitely, probably we are going to start this diploma courses very shortly. Already the Chief Secretary has given instructions to the Health Commissioner to map the hospitals which are going to be eligible to start these courses, and what are the specialization available. Accordingly, we can map out these things. So definitely, we are going to take it up in a big way, and it will help to improve the patient care in Tier 2 or Tier 3 cities. There's no question about this. We are going to take it up in a big way.
Thank you, sir.
If I may just add that all the ANBI state presidents who are here will also take it up with their respective governments, both to promote DNB and the diploma in the district and taluk hospitals.
Thank you. Thank you, Dr. Alex and Dr. C.N. Manjunath, sir. Now, may I now request Dr. Devi Shetty, the chairman of Narayana Health, to kindly give his closing remarks.
Good morning to everyone. First of all, we are most grateful to the Prime Minister, Ministry of Health, Niti Aayog, and National Board of Examination for liberating higher medical education. I would like to put on record that, especially to my friend Dr. Abhijat Sheth and Dr. Pawanindra Lal, that National Board of Examination is truly a savior of this country. but for the specialists from National Board of Examination, India would have never dreamt of reaching this level of healthcare, especially in secondary and tertiary level healthcare. Launching of diploma courses in 8 broad specialties, according to me, is the most radical reform undertaken by the government in the recent past. Healthcare will never be the same. I will give you a simple example. Because of the COVID, the discussion was all about there are no beds in the country. We are short of ICU beds. But very few people realize that the beds do not treat the patients. It is the doctors, nurses, and medical technicians. We are desperately short of them. A country with 1.3 billion people has only about 40,000 anesthetists, 10,500 radiologists, less than 40,000 pediatricians. How are we going to manage the healthcare of all these people? Now, this diploma course will make all the problems what we have undergone a history. I'll give you a simple example. Every year, 170,000 young doctors apply for NEET examination for the PG entrance exam. Just about 40,000 of them get into the PG seats. Now, 130,000 doctors who did not get the PG seats will not go back to managing the, they will not go back to the clinical practice. All of them head towards Kerala or Kota to join one of those coaching classes and to mug multiple choice questions for the next 2 to 5 years. And most of them do not get the PG seats, and a good number of them ditch the medical profession. Now with the diploma seats happening, I'm optimistic that we will be able to pull back at least 30 to 40,000 of these young doctors back to the mainstream of touching patients and caring for them. This will have a massive impact. Now, we have realized across the country, only the government hospitals which are teaching institutions are vibrant. And teaching institutions are always placed in big cities. Today, all the taluka hospitals of the country, 700 district hospitals of the country have an opportunity to become postgraduate institutions. And this can be done without diluting standards. I'm so happy with the National Board that they launched the diploma course, 2-year diploma course, and not 3-year master, the 3-year master's degree. Because if they expanded the number of 3-year DNB seat, that training program can happen only in big hospitals which are already conducting the training program. Pushing more students to those hospitals will only dilute the standards. But having them in any hospital with over 100 beds, government hospital, private hospital, with over 100 beds with very good senior medical faculty as the trainers, this will open up our entire district and taluka hospitals into a different world of academic institution in taluka and district level. Why this is important? Because today our government hospitals are short of 80% shortage of medical specialists in our government hospital. With this training program in 2 years, we'll be able to produce huge number of these doctors who will be able to occupy this position. In the end, our mission is to make government hospitals vibrant. Now, I would like to thank Karnataka, which has one of the most progressive governments. The government has decided to evaluate 170 taluka hospitals, which are today not part of the training program, to consider becoming the institution to train the young doctors. So I believe with this, our maternal mortality, infant mortality will come down. Now, the most important message I want to give to everyone: center government, national board, medical council have done their job. Now the ball is in the court of state governments. It is now up to them to apply for these PG seats in all their medical hospitals and ensure that the infrastructure required for the training program happens. Now it is up to the citizens to demand from the state governments that they encourage the Ministry of Health to apply for these seats. And with all this transformation happening, I am convinced that within the next 5 years, India will become the first country in the world to dissociate healthcare from affluence. Once again, all this happened because of our government, our Ministry of Health, the National Board of Examination, Niti Aayog, and all of their contribution. We are extremely grateful to all of you. Thank you very much.
Thank you, sir. Thank you very much for your closing remarks. We come to the final leg of the e-press conference. There have been questions. Some of them have already been answered in the chat box. The ones that have not been answered, we would like to present it to the concerned panelists. And here we have 3 questions which are interrelated. And I suppose Dr. Pawanindra Lal would be the appropriate person to take these questions. How many seats will increase in gynecology to ensure quality childbirth? By Rahul Chawla, who has also added one more question. When will these PG courses begin? And how many seats for ophthalmology will increase? And will MD seats not be affected? Diploma holders and MD holders will both be specialists. I think Dr. Pawanindra Lal and Dr. Abhijat Sheth can jointly take this.
Okay, thank you, sir, for this. I think firstly, the question about training, the launch is happening from today, and it is really up to the state government hospitals and other hospitals, as Dr. Devi Shetty very clearly said, that it is up to them to grab this fruit now. It is all in their taking. It's a low-hanging fruit. They need to apply, but they need to also be aware that there is a requirement of faculty, beds, and procedures, even for this course. So they must meet those requirements, and if they think they do so, they should apply in right earnest. And the closing. So that is the first part of it. The second part was the number of seats that are likely to rise. I think easily I can envisage that if everyone and all district hospitals and all smaller hospitals were to apply with their current positions, 500 to 1,000 seats per specialty can actually be in the taking. Obviously, we will need to do the assessment and accreditation, but I would roughly say that easily 500 seats, up to 500 seats could go to one specialty or important specialty like gynecology and obstetrics, or pediatrics, or family medicine, because these are all general specialties, and they are there, their specialists are there, they're doing a large amount of numbers. So, but we need the applications to come in, and we need the all the formalities of paperwork to be completed and compliances to be ensured by the authorities of the state or of the institutions concerned. So I think that was the main point which was being asked, Dr. Thomas.
Thank you, sir. Thank you very much. Now, there is a question to Dr. Manjunath from Ranjani Madhavan. How many specialists will be added each year with the help of these diploma courses in Karnataka, and how long is the course? That, of course, has already been answered. Dr. Manjunath, please.
Yeah, anyway, the duration of the course is already it's 2 years. But regarding at this point of time, we are in the process of mapping the hospitals. So whether, because I was told the eligibility also, the national board is going to come out with the eligibility, which are the hospitals which are going to be eligible both with infrastructure wise as well as bed wise to start this diploma courses. So when once all this mapping is done, we will be in a position to tell. At this point of time, it may be too premature to tell how many seats will be there in each specialty. But definitely, I am sure the maximum number of seats will be in OBG. Maximum number of seats will be in OBG, followed by anesthesia and radiology, because almost every taluk hospital do have a gynecologist, do have a at least one anesthetist, and also, so probably maximum number of seats will be in DGO or diploma in OBG.
Thank you, sir. Thank you very much. Then question from Suman Agarwal. She has a question that do you think that increase in this number of seats are sufficient to overcome the healthcare crisis? I do not understand whether they mean the crisis through which we are going through now or over a period of time in the sense. Now, I think Dr. Devi Shetty can take this question. He is always on the tip with statistics.
I agree, we have massive shortage. This is just the beginning. And once we start this process and experience the fruits of all these regulatory changes, I am optimistic the floodgates will open, because in the end, we need to equalize UG and PG seats across the country. Most of the developed countries have more PG seats than the UG seats, so that doctors from overseas can come to their country, get the training. In the process, they serve the backward parts of the country, get the training and go back to their own country. Eventually, India will also go in that path. So our aim is to go for equalization of UG and PG seats, at least in the near future.
Thank you, sir. Thank you very much. There's a very interesting question from Rahul Kaul. What if states refuse to implement this? Shouldn't these courses be made mandatory? I think this question should be taken by Dr. Abhijat Sheth, because he is the authority. Dr. Abhijat, sir?
Yes, sir. See, by and large, the state works in the harmony and coordination with the central government. It rarely happens with such a policy decision that state and central government will differ. Normally, what happens, they differ on certain principles, which they ask central government to address, and central government comes to us that can we address this principle in this way. So national board is open to help the individual states if they have any concern about these courses. And as Professor Lal has said, that it's in the board of the state, ball is in the board of the state. But having said that, the national board will be always ready to help, to come over the problems with the state to implement these courses, and we ensure the full cooperation to the states, and we want to make sure that the quality doesn't get compromised while running these courses. Hence, the minimum standard the state has to establish across the board, and we are committed to help all of the states. So I don't think there will be a huge opposition between state and center with this. There may be some issues which state may ask us to address, and we are ready to help with it.
Thank you very much, sir. We have another question relating to the Association of National Board Accredited Institutions. And the question is, what are the future plans by the ANBI to play an important role in rolling out this PG diploma courses and assisting them. I think the UNBI president, Dr. Alex, will be the appropriate person to take this question. Dr. Alex, please.
Thank you, VC. I think from the UNBI point, in fact, I speak for all three organizations, AHPI, UNBI, and CAHO. We will support the government in this and do whatever we can to promote it through all our state chapters and the state presidents. But I will also like to add specifically what UNBI has already started and what we are doing. So can I request Dr. Venkatesh, our Secretary, National Secretary of UNBI, to very briefly give us plans of what UNBI has to promote this and to help the teachers and the hospitals?
Yeah, thank you, Dr. Alex. Can you hear me?
Yeah.
Go ahead, Venkatesh.
Yeah. Thank you, Dr. Alex. Yes, we understand that we need to walk hand in hand with the government and with the NBE when an exercise like this is taking place on such a massive scale across the country. We are aware that when the courses are started, we are dealing with a set of doctors who become faculty who have no experience with dealing with the NBE as well as in the teaching field. We have already structured a training program for these hospitals, whoever wishes to take up or whoever gets accredited. In Karnataka and Tamil Nadu, our national academic coordinator has already put in place training programs. Government hospitals which have taken up DNB is extremely happy with the kind of support that we have given. We understand that the national board is a governing body and really will not have the time or the bandwidth to get into nitty-gritty. It is left to us to do this. And UNBI is very happy to step in and do this so that the standards of teaching in these hospitals are maintained as per the NBE requirements.
Dr. Venkatesh, we want to add something? You're done. Thank you. Thank you very much. Now, I think we come to the last question. And of course, it has been partly answered in the presentation. However, the question is, how do you see that in tier 2 and tier 3 cities, the scenario is going to completely change by this dramatic decision of increasing postgraduate diploma seats? And I think the question should go to Dr. Devi.
Thank you, VC. First of all, in Taluka and a lot of the district hospitals, it is impossible to attract young doctors to work. And this is the case not only in India, across the world. I did my first job in England in a TB sanatorium in Leeds, not because I wanted to serve the people of that area, because that is the only way I could get a certificate that I worked for 6 months in that particular hospital in that region. That helped me eventually to get the residency program in Guy's Hospital in London. So by making the taluka and district hospitals, community health centers as training institutions, all of a sudden you make those hospitals very attractive for young people to go, work, learn, get the degree, and then become experts in whatever they are doing. That is the only way healthcare will reach out to the backward parts of any country, and India cannot be an exception. Till date, we have segregated medical education from healthcare delivery in rural India. Once we combine the objective of primary, secondary, tertiary care in rural India with medical education as the carrot for young people to go, there will be a dramatic transformation the way in which healthcare is delivered in these parts of the country.
Thank you, sir. Thank you very much. And with that, I think we have addressed all the questions that have been posted And we would like to conclude this e-press conference. We have had 54 participants from the press and media, brilliantly answered by the panelists, and those among the specialists, that such as Dr. Rajshekharan. He is the president-elect of the Association of National Board Accredited Institutions. Dr. H.S. Chabra is the vice president of Association of National Board Accredited Institutions. Dr. Venkatesh Krishnamurthy, National Secretary, ANBAI. Dr. Babadosh Biswas is the former vice chancellor of the West Bengal University. Dr. Vijay Agarwal, president of CAHO, and of course, Commander Navneet Bali is the chairman of the Media Engagement Committee, Association of Healthcare Providers India. Hello, am I audible? Oh,
yes, yes.
Yeah. And with that, I would like to thank the members of the media, the press, and all the panelists, especially those from the government. And thank you very much for this active participation. Thank you. Thank you very much.